Clemmons. I'm the Executive Director for Hawthorn Neighborhood Council / North Side Urban Coalition. I would like to welcome you to our February Hawthorn Huddle. It's always good to have my co-hosts with me, Miss Ann DeGrew and Mr. Clarence Jones. And without further ado, I am going to turn it over to Mr. Clarence because we have a dynamite show today.
Right, and I appreciate that, Diana, because I want to be very brief too. Welcome everybody, and we usually give people an opportunity to say a little bit about themselves. So I'd like you to very quickly introduce yourself and tell me what do you miss most about not having snow? Just real quickly, and I'm gonna tell you nothing. I enjoy not having snow, and we'll start with you because you're on my list first.
I'm Ann DeGrew with the Minneapolis Youth Coordinating Board, and I actually don't miss anything either. I love not slipping and sliding. Diane.
So I'm gonna say this real briefly, but I want everybody else to follow suit. Instead of talking, if you could just say one word. He's already asked the question because we have a lot of people jumping on. So one word, nothing. Next person.
Audway.
Hi, everybody. I'm Audway Pugh and nothing.
Julie.
Good morning. My name is Julie Dalton and nothing as well.
Ms. Mary.
Nothing.
Gentleman from the fire department.
After last winter, nothing.
Teresa, did I call on you yet?
Teresa Ambrose, Minnesota Department of Health and cross-country skiing.
Oh, okay. Bill?
Bill Magnuson, crime prevention, 4th precinct. I don't miss nothing.
Miss Cheryl Lee, I haven't seen you in years.
Hello there. Cheryl Lee Sherry with the Minnesota Department of Health. I came in a little bit late. So the question is, what do I miss about
not having snow?
Oh, I miss skiing, cross-country skiing, and just being out and about.
Okay, thank you. Sean
Lewis, Minneapolis Parks Foundation, nothing.
Oh, okay. Miss Julene?
She's without audio. She said nothing in the chat.
Okay. Miss Princess?
Princess Titus, I missed an opportunity to exercise and shovel.
Oh, okay. Well, Georgie?
Good morning. Georgie Kinsman, Minnesota Department of Health, and I miss skating.
Sandra?
Good morning. Sandy with Hennepin County Child and Teen Checkups Program. I would say shoveling for exercise.
Okay. Mary?
Good morning. I'm Mary from MWMO, and I miss nothing.
Hillary?
Hi, I'm Hillary, also with the Minnesota Department of Health, and I miss sledding with my daughter.
Okay. Louisa?
Louisa with the City of Minneapolis Health Department. I miss cross-country skiing.
Abby?
Hi, sorry. So mine disconnected early. I'm not sure what the question is.
What do you miss most about not having snow?
I would say ice skating, and I'm Abby with Queer Space Collective.
Okay, thank you. Anna? We'll go back. Miss Julie, did you get a chance to say anything?
She put it in the chat, Clarence. She said.
Oh, did she? Okay. Yep. You know, and I think is it Keebalin?
Yes. Hi, everyone. Sorry, I'm a few minutes late. My name is Kavelin Alandez. I work for the Minneapolis Health Department.
Well, thank you. Did I miss anybody? You know, at my age, I forget a lot of stuff. So just forgive me if I did. Okay. Thank you. Thank you. Yes, Ms. Dinah.
Can I get everybody to please mute yourself?
Okay. Well, thank you all for doing that little short exercise with me. So now we're going to have Louisa, who's going to give us a COVID and other health updates from the city.
All right. Good morning, everyone. Nice to see you. And, I hope you got to enjoy the nice, sunny, warm weather yesterday. It felt like the beginning of summer almost. anyway, in terms of our viral respiratory diseases, infections, that the trends right now are all downward. So it seems that we have peaked in terms of our hospitalizations and cases. We are starting to see a downward trend on all of those. Still, numbers are not low, but on the downward. So that's good news. It is not too late to get your booster for COVID. It does offer some protection. So the city is continuing to do vaccination clinics. We'll have a couple next week. We will be at the Community Connections Conference on the 17th, and all of the schedule is on our website. I also wanted to make sure that if you haven't seen, it's been on Facebook and other social media, but the city tree lottery will be opening February 1st through March 31st. And also, if you are either in the South Side Green Zone or in the North Side Green Zone, there is currently a program that you can sign up for to get trees. This is to try to replace the tree canopy that was lost with the tornado and due to emerald ash borer. And you can sign up, and there'll be someone that will come out to your property and work with you to figure out the best place to plant a new tree. And I think there's a few that you can choose from. There's a form online that you can sign up, and I'll try to put the information in the chat so you can get to it. But otherwise, we have seen a few cases of Mpox coming back, and so continuing to also provide that vaccination. And just we are doing some work looking at trying to make sure that working with Minneapolis Public Schools to look at how we can assist with having kids get caught up on their childhood vaccinations. We're still trying to recover from some of the drops that we saw during the pandemic, the big 2020, 2021. There's a lot of catch up that needs to happen. So those are some of the things we're working on, and happy to take any questions.
I'm sorry, I was muted. Are there any questions for Louisa? Diana?
I'm sorry, I was trying to get off of mute. Louisa, now I heard that there's a spark in the COVID. Is that true? A rise? I mean, they said it was coming down, but then it went back up.
The data that there are some parts of the country that are seeing higher numbers. Minnesota right now, we are seeing a downward trend in the numbers that we can track. So, we're seeing a little bit of a downward trend in the hospitalizations and the wastewater surveillance. That's the things that are really that we can track. Testing, number of positive tests is very hard because with everybody having access to home testing, those are not reported. So you're really tracking the more severe cases and then the wastewater surveillance. And for that, we're in Minnesota, we're not seeing as much of in particular in Hennepin County, we're not seeing an increase right now, but there are other parts of the country that are seeing more activity. And COVID hasn't behaved quite like your regular respiratory, like the influenza and RSV, where we see it really rise in the fall and winter. COVID doesn't seem to follow those patterns. It has been, in that sense, it's a weird, it's hard to predict. So we've seen waves in the summer when we expect that we won't see as much because people are outside and are enjoying them, and there's not that close proximity. So it's not to say that we're seeing a downward trend now, and it will, in a few months, we won't start to see a upward. But so I think COVID is something that we're going to continue to wrestle with and try to figure out exactly how to keep safe. So I know that in New York City, for example, they've seen an uptick, and a mask mandate has come back, and they're asking people to wear masks in hospitals and clinics. And so it really is dependent on the region of the country that you're in, what we're seeing.
Thank you.
Thank you. Are there any other questions for Louisa? If not, let's go to the safety report with Bill Magnuson.
Yes, morning, everyone. So for January for the Hawthorn neighborhood for Part 1 crimes, I'll remind everyone of Part 1 crime is anytime there's a victim. There was 2 homicides, 2 rapes, 2 robberies, 11 aggravated assaults, 4 burglaries, 5 thefts, 10 auto thefts, 0 arsons, for a total of 36 Part 1 crimes for January for Hawthorn. Does anybody have any questions?
Questions?
Bill, I noticed that they said the carjackings are going down. Is that true?
From what we could tell, the carjacking seem to be going down. I do know that auto thefts are still kind of high, and that's a lot of times it's not the same type of a carjacking. A lot of times it's we try to get people not to go out there and warm up their cars, and it's not really an issue with this type of weather. But when it got colder for that 1 week, there was a spike in that type of theft where it's open ignition. And then what we've seen recently too is probably on the news last night is where people are filling their gas tanks and they probably leave their keys in their car while they're doing that, and somebody will come up and get in their car and take off that way. So you just got to be cognizant of the fact and mindful, like if you're out there getting gas or whatever, anytime that you leave your car, even if it is just for getting gas or something like that, just take your keys with you, and it doesn't hurt to lock it either.
Right. Thank you. Are there other questions for Bill? Hearing none, I'm just going to do a short report for Human. Actually, I'm very, very excited today that we have MDH here and this topic. It's been something that has been mentioned in Hawthorne many times, and it's just great that we were able to get the MDH department to come and to visit us. And so I'm looking forward to the presentation that's going to happen. Secondly, the other thing that we're doing is that we are actually doing a couple of surveys with NIH to take a look at what are the 3 primary health concerns that people have in our community. And so we will be doing that for the next couple of months. And we do have one section where we're going to actually specifically look at African-American men and ask them what are their 3 primary health concerns. The interesting thing about this particular project is that the information that we're going to get is going to come back to the community. So, which is one of the things that we always want anyway. But it's really exciting that that's just part of what they put into the contract. That when the information is evaluated, they're going to come back and they're going to disseminate it to our community. So, I just want to just say thank you to Hawthorne for being one of those organizations that have helped us to have this kind of interaction with NIH. With that, I guess we're going to go into, because we had this great presentation, we're going to go into honoring those who make us better. And so I'm going to turn this over to Diana and Ann.
Okay. Guys, this is my favorite part of the program. So, if you're able to turn your cameras on, we would appreciate it out of respect for our honorees. Miss Ann, I think you were up first. I'm not sure if he's here or not, but we will still honor him. And so,
I have not seen him.
Okay.
But I
honor him.
I think we will go forward anyway, Diana.
Yeah.
And I must admit that I don't know this person, but Diana sent me some information about, I think he just came.
He just came in.
Yeah, he just came in. Hello, Andrew. Glad to have you here. So I just read about this fellow, and I'm very happy to get to know you, Andrew, a little bit. Andrew is someone who works with one of our other awardees, Jim Barrett. And it turns out that together they put together these Save a Life Safe stations. The objective is to bridge the gap in readily available free overdose prevention resources, particularly in areas where access is limited. So they place these stations in highly visible public spaces such as bars, restaurants, co-ops, libraries, and retail locations to help save lives. And it is a way to make opioid I'm sorry, I'm really having a hard time with my words today, but it's a way to make life-saving things available for people who are overdosing on opioid and fentanyl. So it's a wonderful thing that these guys do, and we really appreciate them doing it. And it is kind of a creative way to work to make sure that we can all have access to these kinds of resources for people in our communities. So we really appreciate you guys doing this. And I think you are here, am I correct?
Good morning, Andrew's here.
Andrew, great, good to see you, Andrew. Hi.
Good morning.
Welcome. Here's your plaque. Andrew, would anybody else like to say a few words to Andrew?
Well, I just want to make sure we give Andrew a minute to talk about his stuff. And, you know. Andrew,
please tell us about your work.
Well, it's myself and Jim Barrett. And I think we identified that there was a sort of a void, sort of dead spaces in our communities for friction-free access to these life-saving tools. And while we commend the outstanding work of the Steve Rumler Hope Network, without them we wouldn't be able to do what we're doing. Their NAP or Narcan access points are a little few and far between. I live in Northeast Minneapolis, for example, and the closest access point to me is on their website, identified as at an accounting office in Roseville. And when you contact that accounting office, no one's aware that they are an access point, and there's just a lot of friction involved in accessing some of those materials. And so we're just doing simple work to try to increase the availability of these tools. And Jim and I have discovered along the way, you know, that we're through the outreach work that we're doing, we're running into, as all of us on the call are going to recognize, some of the stigma that surrounds addiction. Some from business owners to community members to politicians, is just going to invite the drug addict into my store, into my community. And so our work is our outreach work is helping to break down some of those barriers and misconceptions as well.
Thank you, Andrew.
Thank you, Andrew. It's life-saving work.
Yes.
It is really life-saving work.
And can I ask Audrey to say something?
Yes, Clarence.
Yes, I will, because you know I am super excited. We have a box at Jack, and I am so happy to have that box. And we had a couple of things, issues with it because it's cold outside, so having it outside. But before it got cold, we had put like 35 kits in there, naloxone kits, and they were 25 of them were gone within 2 days. So it's much needed on that corner of Penn and Broadway where we are. And I was talking to Jim about somehow we need to get help with funding to get those boxes possibly insulated, to make them even that much more better. But I think those boxes are amazing, and I am so grateful that I was able to leave we had a event over at over South with Human, and I was able to leave with one of those boxes. So yay, thank you.
Thank you, Agway. Thank you. So I guess
well, that's one of the benefits of being so small. We're not encumbered by I've got to ask my boss or I've got to see about this. It's really just spreading the love.
Thank you, Andrew. So I'm up next, and the person that I have, I'm really excited because I've known this person for a while now, and I'm just gonna say a few things about this lady. Her name is Agway Pugh. She is the executive director for the Jordan Area Community Council, in addition to Off the Blue Couch and Rusty and the Crew. She's also a community organizer. She's a publisher. She's a published author. She's an educator. She's a certified peer recovery specialist, a notary, and a Narcan trainer for the Steve Rumler Hope Network. Now, I want to tell you something that Agway said that I read about her, and this is why I love her. Agway says, trust people until they give you a reason not to. We don't have to agree, We just need to reach the mutual goal, and she knows for sure that God is real. Wait, I have to give you your prompts because you have brought Jack back around. You have been out here doing amazing work. So can you please take a few minutes and just tell us a little bit about yourself? So, and then we'll move on to the next award. Ms. Agway?
Thank you. Thanks, everybody. Thank you, Diana. When Diana texted me and said, check your email, I called her right away and I said, stop playing. She said, I'm not playing. I'm serious. I am so, I don't know if y'all can see my tears right now, but I am so happy and filled with joy that because I just do what I naturally do. This is who I am. And I just want to serve people. And because by the grace of God, there go I. I'm a recovered drug user. And when I see the people on the street, I just want to help them somehow because by the grace of God, there go I. So I thank y'all so much for choosing me. This is truly an honor for me. And I'm going to do my best to not let myself and others down, and you all who have given me this honor. So thank you so much.
Yes, ma'am. Mr. Clarence, is your person around? You see him?
I don't know. Is Dr. Jim Hart, is he here?
Okay, we'll go to him, and if he comes on, we'll let him say a few words. So go ahead, you can.
Well, let me say this about Dr. Hart. Okay, he has worked for more than 30 years in primary care medicine. He has been director of the executive program in public health practices at the School of Public Health. He has served on the board of WellShare, and he continues to stay engaged in Minnesota health policy discussions. Now that's the big picture. Okay, the question really is, why was he selected? I have observed Dr. Hart since 2008. I've seen him in what I call very unusual places, bringing himself. He brings his information, his resources. He assists. He tries to help in any kind of way that he can. He's a very high level person, but at the same time, he's very, very approachable. One of the reasons why he has been selected by HUMAN also is that he has taken the time to try to mentor me. That's so this is a selfish award, but it's also because of his mentorship that I've been able to address a lot of issues that and he's been able to open up some doors for us. So I don't know, Sean, did we have lunch with him a couple of times?
Yeah, we probably did. Yeah.
So him and Arthur Himmelman would have lunch with us to talk with us about collaboration. How do you collaborate? How do you work more effectively with people? And so it was a great honor for us today to present this award to Dr. Jim Hart, because as I said before, is that he has been working a long time behind the scenes, and we wanted at this particular point to show our respect and to honor him. So thank you. So he'll get a chance to come on.
Clarence, can you take a few minutes and just explain what the new He-Man award is, so people will understand that when they see these awards, they're going to see this one award that has that He-Man logo on it?
So one of the things that, and I appreciate you asked me that, Diana. One of the things that we have done this year, and HUMAN has been, we've tried to be creative in trying to find what we call treasures in our community. There are a lot of people in our community that are doing work that we don't necessarily know about. These are people that are very quiet. They go about their business, and for years and years and years, they're not necessarily seen. So what we have done is we've taken this position that we want to honor people that we know have a long history of helping our communities to become healthier. And so HUMAN has been very, very intentional in terms of finding and uncovering those treasures to make sure that they have an opportunity to smell some of their roses, while they're living. And so that's why Human is doing this. At one point we had My Brother's Keepers Awards. We've had Community Health Heroes Awards. But this year we just want to recognize people in our community that have been working for a long time that we believe need to be recognized. And so this is why we're doing what we're doing.
Okay, thank you. I appreciate that. So I'm up now. And the person that I have the pleasure of honoring, I met some time ago, and we became friends. And we both were part of He-Man. And I gotta say, Jim, you are the most straightforwardest person that I have ever met. Jim is the other half of the Save a Life Station, and Jim's commitment to recovery runs deep. He's fueled by his personal journey and his work with the Minnesota Recovery Corps and the Humane Partnership. As a recovery project coordinator, he saw the crucial role of preventing and ready availability resources. This inspired him to launch the Save a Life Station Project, a network of overdose prevention stations in public spaces. Jim's mission is to equip communities, save lives, and offer along the path to recovery. Jim, I am so honored to present this award to you, just knowing you, the little bit of time that I have, and the conversations that we have. So I am very pleased to present this award to you. And if you could take just a minute, Jim, to tell the people a little bit about Jim.
Thanks so much, Diana. I really appreciate this. Almost 2 years ago now, I left my job and decided I was going to walk down some paths I wasn't sure of where they would take me. And I became a certified peer recovery specialist, and that led to Minnesota Recovery Corps, and Minnesota Recovery Corps led me to Clarence and Humane Partnership. And that's been quite a journey as well. And I've met, you and so many other people in the community. And as Clarence says, calling out people who are doing work, and a lot of folks might not know about it. And so I've met, so many folks such as yourselves and others out here on this call who are doing really amazing things. And I just feel real fortunate that I've had the chance to find out about all your efforts and see what you're doing. And that's really inspired me to try and find other ways that I can help the community have healthier, safer lives. So it means a lot for me to be with all you folks, like on this call and just in spirit throughout the times in between. And thanks so much.
You are welcome. Miss Ann, I know that you need a few minutes, and the lady from the library need a few minutes to make an announcement. So you guys, just so you know, we had to move our announcements up because Mr. Clarence has a real heavy duty topic we're going to talk about. So Miss Ann, I'm going to turn it over to you real quick to make your announcement.
Thank you, Diana. I'm going to try to make mine relatively brief because there's other ways to find out about it, but I wanted to let you all know that the city of Minneapolis is going to be designated by UNICEF USA as a child-friendly city on February 14th. We will be the second city in the United States after Houston to be designated in this way. This is a designation that happens throughout the world. It's a worldwide designation that was just brought to the United States about 3 years ago. So we will be designated. The Minneapolis Health Department and the Youth Coordinating Board have been working very hard on this for the last 3 years. What I want you to know about this is that this doesn't mean that it's like the end of the road, like we're child friendly, we're done. It means that we have agreed with UNICEF USA as a city to engage in a process to continually work toward becoming child friendly. And what that means is that we acknowledge that we are going to be working on child rights, that we are going to be working to center children and young people in decision making in the city, Our 4 areas of work so far, and they may change, have been emergency preparedness. And I will tell you, the city has made significant changes in the way that it is doing emergency preparedness in the city. Prior to this, they did not include thinking about children and young people if there was an emergency. They didn't think about them, they do now. It will be work toward ensuring that children and young people are included in civic engagement. The Youth Coordinating Board's done that for a long time, but the city is now doing that as well. The third area is community safety, which you learned about last month, and we'll be working a lot on that. We're just at the beginning of that. And the fourth area that we're going to be working on has to do with child rights and child rights education. And we do that in 2 ways. One is we work with health centers to provide books to young children about child rights. So Hennepin Health, little kids come and they get a book. The doctors and nurses read to them, and then they give them a book to take home. And the second thing is we're working with Minneapolis Public Schools with their social work curriculum to add to what they already do about child rights. So those are the areas we're working in so far. So on the 14th, the president of UNICEF USA is coming to present the designation to the mayor. It will be at 10 o'clock in the morning, and it's a press conference. You will all be invited to attend. I'm inviting you all. It will be in the public service building, so the new building downtown on the 1st floor. And the third one, Ms. Jackson, is community safety. And you will hear more from us because you're welcome, because we're going to be developing the next 3-year plan. So we will be required by UNICEF to do a 3-year plan. So at the Community Connections Conference on February 17th, we are going to be facilitating an afternoon conversation about child-friendly cities, focusing on community safety. Because we have, as you remember last time, those of you who were at the huddle, there were 9 areas that emerged from our research with young people and parents of young children. We got very good information from you, and actually you helped us figure out what our agenda should be for the Community Connections Conference. So we're going to use that, and we're going to move forward to get some more information from people that day about what they think the priorities are as we develop our 3-year plans. We want you to join us. It's very exciting, but what it is a way to commit the city to working on centering children, young people, and their parents in the city, to making sure that Minneapolis is a child-friendly city long-term. And we welcome everybody to join in that process, okay? We have an affiliate program, which if your organization's interested in affiliating, I can hook you up with that. I can show you how to do that. There's a form to fill out and stuff like that. And we will have an ongoing affiliate convening each year where we bring people together to talk about that work. But we'd love to have you involved. And so I just wanted to tell you this, that it's something that is happening. If anyone has questions, feel free to contact me. If there's something right now, I could answer a question, but I don't want to fill up our whole time on this, but I'm happy to answer some kind of quicker questions.
Thanks, Ann. And they can always put it in the chat too as well. Is Miss Anna here from the library? I want her to take 2 minutes and introduce herself and let her know the changes at the library. Are you here, Anna?
Yeah, I am. Looks like my camera's just turning on. Can everyone hear me?
Yeah, we can hear you.
Yeah, great. Thank you for having me this morning. My name's Anna. I'm the Adult Services Librarian at North Regional Library on Lowry. I started there in October, or started at that library at least. I've been in the system for a while. But it's been really exciting for me to get to know the neighborhood, get to know groups like yours. I was really happy to connect with Diana and be invited to this meeting. So I'm just going to really briefly talk about some of the things we offer at the library. Like Anne said, there's other places you can find this information, like our website, or you can email me directly. So I'll try to be brief.
2 minutes.
Yeah. So one of the biggest resources we can offer at the library is our space. We have really big meeting rooms you can rent for free. So I always like to mention that first to, I know there's people associated with like various groups in this meeting. Please take advantage of the space we have at the library if you ever want to have a meeting or event that is for you to use. And then kind of in my role, I work on a lot of like tech help, job access programs. So we have a lot of community partners coming through the library to help folks get a job. We have youth programs like MPS snack every day and lunch in the summer, free to all youth who are 18 and younger. And then we have a whole variety of really fun youth programs going on through the week. Video games, craft programs. There's a teen tech squad. It's a group of teenagers who are employees who put on arts and crafts based activities for younger folks. And then again, on the adult side, we have a book club, we have a craft club, we have a coffee and conversation program every month just for neighbors to get together and drink coffee and eat snacks and get to know each other. So we have a lot of really, really great things happening at the library. We're going to have a neighborhood health source starting soon to do some regular Narcan education programming. And I will keep Diana updated with all this stuff so she can kind of disseminate all those flyers and stuff to you all. So yeah, that's what I'll say for now. I could go on, but I know I have limited time.
That's okay. We've talked, so it's okay.
Yeah. Thank you for having me. And it's just an invitation to please reach out to me. My email's in the chat if you ever want to connect on doing a program together at the library, or if you want to use our space.
Well, thank you, Miss Anna. And I have one thing that I'm going to say real quickly so I can turn this over to Clarence. But I wanted to let you guys know that on February the 17th, Hawthorn is holding a Black History Month Day, a new year, a new you, at our office at 2944 Emerson Avenue North. It's really for our Hawthorne residents, but it's a pop-up clinic. So, we know we're going to have people that are going to pop up. You can get your blood pressure checked, your glucose checked, Narcan availability, COVID test, mask. For young men, small guys, we have some clothing that's limited. For young ladies, small young ladies, we have some winter coats. We have some nice shirts and some nice vests for bigger guys, like a 1X, a 2X. We ask that you live in Hawthorne, but we know we're going to get pop-ups. So I just want everybody to know that. So, if you get a chance, just come on over. The other announcement real quickly is that our February coalition meeting is very, very important. And I'm so glad that we have Miss Princess here with us, because Dr. Rhonda Marie Chiquias and Kalila Bible and Miss Agway are going to do a presentation, a follow-up on harm reduction in the community. How can we help? So I don't want you guys to miss that. And that's February the 16th at 11 o'clock. I thank you for your time. Mr. Clarence, let's have this main topic.
Thank you. As you all know, Hawthorne has a focus on health and wellness, and we have been very much listening to the community about what are some of the concerns it has. And, as I just mentioned before, is that we've been asked in many cases to help to identify what are some of the conditions. And so one of the issues that arose in the past has been this issue around diabetes. And so we sought some activities, and we began to work with the Minnesota Department of Health, the Diabetes Division, which Ms. Teresa Ambrose is here along with her team. And we have done quite a few events. We've had a couple of focus groups and forums with Dr. Stuart Grande. We reported back out to the community. We've interviewed people from our community to ask them about their opinion about diabetes. So diabetes was one of those issues that really was I'm not going to say it was emerging. It had emerged as a issue that people wanted to talk about, and they wanted to learn about it in much more intense manner. And so we've been working very closely with the Minnesota Department of Health to kind of figure out how can we work more effectively together. And so in our conversations, there was this conversation about what they were going to do in the future. And that's how how this started off about child obesity. Well, what was interesting was that I started because they identified it as a upcoming focus. I started hearing more in the community about the concerns that the community had about childhood obesity. And so I remember even I was in the and I went to the office. I was talking to Diana one day, and she was talking about this kid that was 13 years old. He was over 300 pounds. I'm like, whoa, we have to have a conversation, because it was not only Diana, but it was other people that were saying the same thing. And so we asked that Teresa and her team would come and talk with us. And so guess what? They accepted the invitation. They're here. And we are excited that they'll be able to share some information with us about what they're doing, what they're planning. But also we want to know, how could we as a community, because it is a concern of ours, how could we as a community be supportive of you? So I'm going to turn it over to Teresa and let her introduce her team.
Good morning. It's great to be here today. Thank you, Clarence, for the introduction. I am here today with my colleagues, Julie Dalton, Renee Kidney, and Georgie is here too, I think. And we're excited to talk to you and have conversation, because really the solutions and the power of community is so critical to addressing this issue. So in the matter of time, I'm going to keep going here and make sure that we kind of stay on our timeline, and you'll get to meet Julie in a minute. Just a little bit about me. I work with the Minnesota Department of Health right now, and I've worked across the spectrum for the past 40 years in the area of lifestyle and chronic disease prevention and management. And one of my first jobs was at Hennepin County Medical Center as a registered dietitian, where I really saw the devastation that some of these chronic conditions can have on people in the hospital, with amputations and kidney failure, and the patients who are trying to cope with diabetes without housing, without reasonable access to food. And I also worked for many years in a Center for Exercise and Nutrition Therapy with a health psychologist and pediatrician to work with children with severe obesity. And teasing and bullying were such traumatic issues. So I do this work with great compassion and acknowledgement that helping families and children who are struggling with obesity and the related health issues is complicated, and above all else, we don't want to do harm. We want to, promote self-esteem, healthy body image, etc. And I think there's a lot of tension there, but they can live together. I'm going to let Julie say a few words about herself before I get started. Julie?
Hi, good morning, everyone. I'm so happy to be here. Thank you for having us. My name is Julie Dalton, and I am a diabetes prevention planner at the Minnesota Department of Health. I have been with the health department about 8 years, and in my work, I focused mainly on the adult population, working on the National Diabetes Prevention Program. So working to scale that program and help people most in need. Prior to coming to MDH, I was a health educator, and I used a lot of motivational interviewing and different techniques to really help people overcome obstacles and barriers related to improving their health and making lifestyle changes. I'm super excited about this new area of work for our unit. It allows us to work across the lifespan and to focus on our children. So we're excited to be here today and tell you more about our work.
Thank you, Julie. So we'll get started. The first thing I want to show you is this trend chart, because I think it's really telling. At this point in time, 1 in 5 children and adolescents in the United States have obesity. This is 4 times the rate of what we were seeing between 1963 and 1980. So 5% had obesity during that time period. And so it really begs the question of the root cause of really one thing we do know, this isn't suddenly a genetic change. Something in our environment, our culture, our society changed, and we have some ideas about that, and we have, lots of research about the associations of chronic conditions and poor health outcomes that are linked to this growing trend of childhood obesity. And also, if a child has obesity at age 12, the chances 85% of those children will go on to have obesity as adults, which is concerning. And intervening earlier is actually more successful. It's really hard to reverse obesity in adulthood. So I just want you to just contemplate from your own perspective what might have changed, what the root causes are. It's an important thing to keep in mind because individuals tend to blame themselves. Culture, people tend to shame, and there's a strong weight bias issue, and we really need to be sensitive to that. Next slide. So these two graphs depict type 1 diabetes and trends based on race, ethnicity, and the one on the right, type 2 diabetes. Type 2 diabetes in children is really a pretty new phenomenon. This is the type of diabetes that's associated with obesity. And when I started my clinical practice, we didn't see kids with type 2 diabetes. We were just starting to see a few. And the top line represents the growth in type 2 diabetes in children 10 to 19 years of age. Type 2 used to be called adult onset diabetes. This is really concerning because these children will live longer with diabetes, have more severe outcomes earlier in their lives. And the African-American community represents that top line. So it is a real concern. Next slide. So, I alluded to what changed. The food environment is one of the biggest changes in our culture. There's lots of marketing of unhealthy foods. It's everywhere you go. This influences our behavior subconsciously. So just a few, fun facts. Portion size increased 1970s, 1979, first kids Happy Meal for sugary drinks. Those things can have an impact. And of course, we all know about the fat-free phase of the 1990s, which, people consumed a lot more simple carbohydrates and sugars. Next slide. So one of the things that changed in just looking at trends, the trends in sugary beverage consumption very closely mirror the trends in obesity. So addressing this issue can have a big impact because it is the leading source of added sugars in the American diet. And it is one variable and one example of behaviors that affect obesity and the development of obesity. Next slide. So when we look at sugary drink consumption in Minnesota, we see that some communities consume more sugary drinks than others. And these very same communities also have higher rates of diabetes. So again, being cognizant of this as an issue is some of the easier area to address. It's one of those simpler behaviors to change. Next slide. So why is it? Why do we see those disparities in consumption? Advertising is very aggressive, but some communities are targeted more than others, and some have more toxic food environments. And African-American youth do see more TV ads than white youth. And low-income communities, you see a lot more outdoor ads, billboards for unhealthy foods or fast food restaurants. Next slide. There's also, and our Minneapolis Health Department is here, and the amazing colleagues have done a phenomenal job and led the way on concerns about water safety. And there's, people, Flint, Michigan is an example. There's distrust for good reason, or people maybe immigrated and they didn't have safe water supplies in their countries. And so that fear of the water system can lead to consumption of more sugary drinks. Next slide. So these behaviors really can affect multiple health outcomes. And so specific to sugary beverages, this list of health outcomes is real. And, it's really something that's important for everybody. So if you have one child in a family who has obesity, everybody in the family will avoid tooth decay, irregardless of their weight. These behaviors are more important to focus on. The BMI measure is really a measure for population health. The focus of caring for kids should be on, the benefits to them, feeling good, enjoying the foods and the activities they do. But we know that when we help families and people of all sizes do these things, they can have some really important health benefits. Next slide. So this is a projection of what will happen in the United States if we do nothing. This was created a couple of years ago, but children aged to 9% have obesity. If we do nothing, by the time they're 35 years old, 59% of them will have obesity, not just overweight, obesity, the next level. And you look at this trend of increasing rates and, again, addressing this earlier in life and helping people establish healthy lifestyle behaviors, equipping them with tools to live in this toxic food environment can really, really help benefit them. Next slide. So we all know that this isn't an individual issue, although we can equip individuals and families with tools to make sure all of our kids can grow up healthy and thrive. And Julie and I were really excited when CDC made it an option to select childhood obesity treatment programs because for many of the kids and families struggling, there are gaps, and we're really hoping to make sure that kids at the highest level of need have access to these things. So I think there are many, many things that you have all been involved in, and we're really curious about what you're most interested in to reverse these trends. Wrapping around all of these tools and the environment and community are so important, and there's a lot of power there. So those are critical. And I know the Minneapolis Health Department has done a lot of work in these areas. So we're going to not go into detail here. I'm going to pass it on to Julie so she can talk about kind of this new opportunity. Thank you.
Thank you, Teresa. So one important topic I'd like to address is weight stigma. What we know is that the stigmatization of people with obesity is widespread and it causes harm. And weight stigma is often tolerated in society because of beliefs that stigma and shame will motivate people to lose weight. However, rather than motivating positive change, the stigma contributes to behaviors such as binge eating, social isolation, avoidance of healthcare services, decreased physical activity, and increased weight gain, which worsen obesity and create additional barriers to healthy behavior change. Additionally, experiences of weight stigma also dramatically impair the quality of life, especially for our youth. So what can we collectively do? I think we can all raise our awareness regarding the negative effects of weight stigma on youth and their families. We can empower families to be advocates to address weight stigma in the home environment as well as the school setting. And we can also improve the clinical setting by training providers on best practices for non-biased behaviors and language addressing weight stigma and bullying in a visit. And we have access to some free resources and education on weight bias and stigma. And I will put these resources for you in the chat if you would like to look into them. Okay, so in 2023, MDH received funding to implement a strategy that reduces type 2 diabetes risk among children most in need. And the intent of the strategy is to implement, spread, and sustain one CDC recognized evidence-based family healthy weight program. And we know that children with obesity are more likely to have obesity in adulthood, like Teresa mentioned. So therefore, we believe that early intervention is critical to reducing long-term health issues such as diabetes and cardiovascular disease. So at a high level, our proposed strategy to do this work includes conducting a landscape analysis or scanning the community to understand what the needs are and to determine which communities need assistance with addressing childhood obesity and which of those communities actually are ready and want to implement a family healthy weight program. So that we can partner with community to do this important work. We also plan to assemble a work group consisting of community leaders, health experts, and others that will select the best fit program based on the community needs and resources that we find through our landscape analysis. We also are going to identify partners to implement the programs. And we are committed to acquiring and implementing the family healthy weight program that is selected by the work group. Additionally, we know that addressing social determinants of health affect individual and community health directly. So that will be another piece of our work, is to address social determinants of health. And then from there, we hope to increase program availability with partners and staff in clinical and/or community settings. So these are the programs that CDC has allowed us to select from, and I will put them in the chat if you want to look at them more in detail. So CDC provided recipients with 6 evidence-based family healthy weight programs to select from. And the programs include the YMCA's Healthy Weight in Your Child, Family-Based Behavioral Treatment, or FBT. Another one is called Building Healthy Families. There's Smart Moves. Another program is called Mind, Exercise, Nutrition, Do It, or otherwise known as MEND. And then there is the Healthy Weight Clinic. Now, it's important to note that there are common elements to all of these interventions. For example, all the programs utilize an evidence-based curriculum with a foundation in behavioral modification. The programs also include education on the benefits of healthy eating and physical activity, and they require participation from both the parents and the children to promote healthy habit formation and long-term sustainable behavior change, which I think will be very powerful. Now, these programs do differ. So, for instance, some of the interventions differ in how they are delivered. Some of them are all in person, some are a hybrid, and the age ranges of the children participants vary as well. Where the intervention is delivered is also different for each of these. Some are within the community and others are in a clinical setting. And each of these programs also use different specialists. So some include community health workers, whereas others really rely upon clinical staff such as dietitians, psychologists, and medical doctors. So in addition to reducing or stabilizing a child's weight or body mass index, some studies have reported other benefits of family healthy weight programs, such as reducing parent or caregiver weight. It's also shown that there are improvements in nutrition, physical activity, and associated behaviors. The quality of life improves, including self-esteem. Blood pressure, lipids, and insulin sensitivity improve, as well as parental stress, self-efficacy, and quality of life. So one thing that I really want to stress is that MDH recognizes that one intervention will not work for all. So rather, we see this strategy as an additional solution or tool to address childhood obesity and to reduce type 2 diabetes among children most in need. Okay, so now I'd like to introduce you all to a very exciting effort. And I'm going to paste the link in the chat. So in August 2023, Minnesota's action plan to address cardiovascular disease, stroke, and diabetes 2035, or otherwise known as the Minnesota 2035 Plan for short, was released. And this plan is really a roadmap in a call to action for communities, healthcare organizations, community and organizational leaders, and individual advocates to collaborate on how to prevent, treat, and manage cardiovascular disease, stroke, and diabetes for youth and adults through 2035. This plan was designed with communities most impacted by diseases, and MDH firmly believes that community must be engaged in defining, shaping, and creating the solutions. So in order to create real and lasting change, we invite all organizations and sectors to be a part of making the outcomes in the plan real so that the solutions, like the ones that we talked about, can be implemented across settings. So with that, MDH will meet with the Hawthorn Neighborhood Council and its board of directors and connect them to the Minnesota 2035 plan so that everyone here can be connected to this important work. Okay, so we have built in some time for us to just talk. And Teresa and I want to open it up to all of you. We want to know if any questions came up for you or what thoughts came up for you. We also have put in 3 additional questions on this slide. If you wanted to add comments to that, please feel free to unmute, and let's talk about this.
I have a question, Sean Lewis.
Yes, Sean.
My question is, you think about institutions that people navigate in and out of. I'm thinking about school systems. Well, these maybe are systems and institutions, school systems, park systems, churches. How has MDA thought about working or connecting with those, what I would call anchor institutions that are in people's lives?
So thank you for that question. Very critical to influence and work together to support our kids so that they can grow up to live healthy lives. And they're key. And I know that in Minneapolis, many community groups, barbershops, salons, have been doing things. I know Human's done things in barbershops, and there's so much power in community. So if there's ways that we and Minnesota Department of Health, Minneapolis Health Departments here today can help support communities, but much work is going on in schools. There's big federal policy changes, the Healthy Hunger Free Kids Act, which went into play to make sure school lunches were healthier, policies to address all those vending machines in schools. We're seeing impacts from those kinds of changes. So yeah, there's a lot going on. I don't know if anybody else wants to add anything.
Yeah, and I will say too, thank you, Sean, for your comment and question. When it comes to our work group and how I see us growing this is it will be extremely important to have people from all different sectors who support children and families at the table so that we can find a way to kind of braid all of our resources together so that we can better support our families and our children. So having people from transportation, from schools, is definitely going to be part of our long-term plan to engaging all of the different people that touch the lives of children.
I would offer that the Minneapolis Youth Congress, prior to COVID, worked with the Minneapolis Health Department on a project called Rethink Your Drink, in which they talked a lot about how much sugar is in drinks. And they were really instrumental in installing hydration stations in some of the high schools, so they're water stations, and putting in vending machines that had healthier options than soda with a lot of sugar. And that was a great project, and I think the young people didn't really understand how much sugar was in a bottle of juice. You know, you think juice is healthy, we'll drink juice. And then they realized, oh, there's a lot of sugar in juice. So it was a great project that they worked on, and the school district was very cooperative about putting in these hydration stations. So that is the kind of thing that at a school district level can be really a useful project. And I'd like to see us do that maybe again, so.
And this is Caitlin from the Minneapolis Health Department. I'll just add, I know the Minneapolis Public Schools are doing a lot of innovative work around healthy food access. Now, every school in Minneapolis, every public school has a salad bar. Once a month, they source entirely local food for their meals. And also, we know that food insecurity is a driver of obesity, and with the recent passage of universal free school meals for students, that will help address that food insecurity component as well. So lots of innovative work happening in Minneapolis schools around this.
That's awesome. Thank you.
So this is Clarence. I just want the group to know that Human and Hawthorn was a part of the Minnesota 2035 plan through our work with PIP. So we are definitely trying to do some things. But I guess what I want to do right now, Renee and Teresa and Julie, I want to ask you to do this for me. Okay, this is a politically safe space. What do you really want from the community as we talk about this process? What do you really want from us in order to assist in addressing this issue?
I can go first. So within the next couple of months, we will be recruiting members of the community to join us for some focus groups so that we can really understand what the challenges are, what the barriers are, and what the needs are from the community. And one of my biggest asks is that we can get community voices so that we can shape this program and this work around whatever it is that we hear to the best of our ability. You know, we are limited in some ways, but we can advocate and make changes for the community. So that is one of my biggest asks. I'll turn it over to Teresa or Renee.
Yeah, and I'd just like to add to that. Thank you, Julie. And great question, Clarence. I see a comment here from Julene, and you know, these policy issues are really best addressed through community and grassroots organizing. There is so much power in community. There's so many things that could happen and so many opportunities, and you know, focusing on where the most energy is makes a lot of sense. But we recognize communities have power, and I think we can provide education support. We can't, as public health professionals, lead specific policy efforts. Mm-hmm. We can certainly raise awareness and educate so that people are empowered with information. And the state plan is one tool we have where we're trying to build a network and bring like-minded people together through that network so that they can share and learn from each other, and those successes can be shared amongst one another and build power.
Renee, I want to hear from you. Is it okay? All right, I'm not putting pressure on you. Just want to hear from you, though.
It's all good. Clarence knows that I like to hide behind my data. So thank you for having us here. You know, I guess I have a practical thought, and then I have a bit of a dream that we're trying to figure out how to realize. So I'll go with the concrete. I loved Julian's comment in the chat too about doing things in your community. And I would hope people come out of this meeting with some ideas, like what you can do today. I just think about, being in charge of bringing snacks at, my own church. And some of it's leading by example, right? Like we still had sweets and like little coffee cakes and all the stuff people are used to with their coffee. But, one time I brought little grapes and kind of broke things up, or I brought popcorn, right, which is a little more economical. And it just sparked some different ideas for the other people who were bringing treats. So like those little actions can start to shape things in groups that you're a part of. So just to encourage people that you can start today. My dream, I just echo everything Julie and Teresa said. And I'm also really hopeful that in some of the projects we're developing, like we're looking to listen more to community to try to shape the whole of some of the work we're doing at MDH. And I heard about some of the work that Clarence is doing with NIH, and I want to connect a little bit more on that. So maybe we can keep listening, but we can invest more resources in the partnership part, right? Instead of just asking the same questions again to kind of align. And I'd like to figure out, how do we have more councils with community members who are helping to guide our work? So again, that's very visionary. We're figuring it out. Thank you.
So let me follow up with this question. Julian, I thank you for kind of sparking this. I'm doing things very, very zip code-ish in the community. Is that something that's going to be a part of your work too? I mean, we talk about communities. There are, we talk about 55411. I mean, that's generally how people sometimes lump things together. How are you going to address that, or will that be a part of the strategy that you look specifically at geographical areas to take a look at what that specific area might need?
That is one approach. I think one way that we were looking at this when we say communities, and thank you, Ms. Jackson, for your question. We were thinking about the data that we saw earlier in the presentation. So we know that our U.S.-born Black African-American community, as well as the American Indian communities, are the hardest hit when it comes to childhood obesity and type 2 diabetes. So that's what we were thinking, but we may need to, distill that even further, Clarence, and look at specific zip codes that we can really try to zone in on.
Does anyone else have a question for BH?
I don't know if you all can see my hand or not because it's brown up in there.
Oh, there you go. I see it now. Go ahead.
All right. So I just want everybody to be mindful. And I'm speaking from experience because I have always been seen as an overweight person, even as a child. And so a lot of times obesity is not, or being overweight is not from food. It is genetics, and it could be from an illness, taking steroids, different things. So how you go in and look at this situation is, and how to approach it, because it's not all from food. And then if it, in some cases where it may be, you have to think about the food access as well, and the neighborhoods in which people live, and that access to the food that they have to eat, and the corner stores with the chips and the sugary drinks, the quarter juices and things like that. So having an open mind and understanding that everybody that you see that's overweight or considered obese is not that way because of the food that they eat. I'm speaking from experience.
Yeah, I love that.
I've been a big girl my whole life, and I don't overeat at all. So, I mean, I'm not just saying it because it's not me. I'm saying that's how it is overall. Most people that's seen as obese and overweight, they don't want to be that way. It's just something. It just is.
Yeah, Can I say something real quick, Audrey? And I don't mean to be disrespectful in any kind of way. This is kind of more of a joke. I remember growing up though, and everybody would talk about how big boned they were as a reason for being obese. And that's not necessarily true. And I agree with you. We need to be taking a look at a variety of different things. So I appreciate that.
Yeah, and I do want to echo what you're saying. Having worked with endocrinologists and health psychologists, I've seen those children and families. There'll be one person in the family who has severe obesity and a skinny sibling. We even had a term for it, skinny sibling syndrome. They're growing up in the same environment. They're eating the same food. Obesity is a very complex issue. Some don't have the mechanism to turn off their appetite, for example. And, there are real, truly genetic related cases. This population level trend, is, got some population level solutions. So both can exist again. So it's complicated, but we can't, the judgment is unnecessary and like harmful, as Julie said. And in addition, people with obesity, The Greatest Loser was a horrible, horrible show, in my opinion, because all those people gained weight back. Like when you have obesity, reversing it's really difficult. Thus, the importance of helping children establish healthy habits and a healthy relationship with food and all of the other elements that go into supporting health, which can affect weight or maybe not, but health, sleep and stress management and ACEs and food insecurity, all those issues are linked.
Yes, and Adway, thank you so much for sharing your experience with us. We hear you and also know that that's something that we need to keep in mind as we do this work. I will say that through our CDC grant, we are charged with addressing social determinants of health, and our unit wants to release some funding for communities to do food access or to address food insecurity. So that is also part of the work that we are doing, and we will be sharing that information with Hawthorn.
I'd just like to make one other comment that whenever we are doing health fairs, we do have water. We actually have a water that we bring out. It's called It's Just Water, and it was created by a gentleman that had lost his eyesight and had lost his kidney as a result of drinking soda pop and drinking Kool-Aid. So over the last year, whenever Hawthorn does an event or whenever Human does an event, we do bring out water to try to help to address the issue of diabetes. So it is something that I know, Teresa and the group, I know that we want you to know that we are definitely concerned, interested, and willing to, from my perspective, I think, and hopefully I can speak for the group, but we want to be involved. Is it
Thank
okay,
you,
Diana?
Clarence. That's awesome.
Okay. Any other questions?
There were a couple comments in the chat. I don't know if anybody might want to go to those.
So I would
think we
be
should.
mindful
Is
of
there any
time.
more of the presentation, Julie?
No, this is it. I was just going to wrap it up.
Can we
How are
stop
we
sharing
doing
the
on time?
screen so we can do the questions in the chat for everybody?
Okay, yes.
Thank
I
you.
just want to put up our contact information. I know, Mr. Brown, you sent me a direct message, so I would love to connect with you. Here's my email address. Let's see what other comments are here. Renee, can you call them out?
Sure. I'm going to focus on the ones that have questions given the limited time. This is from Julene, and it asked, do you have thoughts about changing the Big Mama visual syndrome that does not automatically mean 300 pounds, which contributed greatly to my family's Big Mamas, another cultural lens?
Because it contributed greatly to their demise and their lack of quality of life as well.
Yes, and that's a really good point, Ms. Jackson. And I don't have thoughts on that right now, and it's something that I want to think about more because I can see how that affects, women and mothers, and how that can impact, a family environment. So thank you for bringing that up, and we will think about that.
Thank you again, Ms. Jackson. I apologize for not addressing everybody properly. There was another one that was asking about the intersection of obesity and ACEs data. Maybe we can start a little bit with ACEs, just because it's an acronym not everybody throws around in their day to day.
So ACEs is adverse childhood experiences. And I have to say, when I was working with families, we'd look at growth curves of children. And if anybody's seen a growth curve, they kind of go like this as kids get older and match, look at kids on average and growth patterns. And in so many of the charts we saw, there would be a child tracking at a pretty healthy rate of weight growth, height for weight growth, and then suddenly it would spike up. And almost to the child, you could talk to them and say there was something traumatic that happened in their life. We were seeing some of the most severely overweight, obese children. So those are things, like their parents were divorced, or maybe they were a victim of rape. So there's maybe they moved from another country. So there are some things, adverse childhood experiences, that were related. So really taking care of the whole child. This is a complex issue, and I know you all are doing really important work, and your whole new recognition as a child-friendly city, so important. All of those elements are so important.
If there are not any other questions, the information, there's a lot of information in the chat.
Come outside.
Princess, did you have something?
No, I don't.
Okay. Sorry about that. Okay. So there's information in the chat for contact information. And so with that, I'm going to turn it back over to Ms. Hawkins.
So we have a few minutes left, and this is the time that we normally have our announcements. So I wanted to know if anyone had any announcements. And I'm not sure who's here from the Minnesota Department of Health, but I know you guys had a new hire just recently. Is anybody here could elaborate on that? She's the director for the Center of Health Equality. Anybody know who this woman is?
Diana, do you mean the Minneapolis Department of Health?
Yeah.
Yeah.
Is that what I said? I'm sorry. Yeah, but that's what I was saying.
I think that they are not here, but next month we could have more of an announcement about that.
Okay. I see Jolene has her hand raised.
I just wanted to, one of the things that we're doing that's coming out of the homelessness work that we've been doing with the governor and the lieutenant governor is that a couple of us have been asked to spread the word in terms of the tax credits. Per the Department of Revenue's statistics, 55411 is one of the numbers that too often do not file their taxes, let alone know about the various benefits. And so I will have more information on that at the next meeting, but just to know that that's coming down the pike. And it's been framed from the perspective of wherever you go, there are people to talk to. And so basically they're asking us to pretty much do it in our travels.
Thank you, Jolene. We got time for one more. Anybody else have anything they want to make an announcement about? Any event coming up?
Yeah, tonight we're going to be at the Jack office, y'all, tonight from 6 to 8. We doing karaoke. We've been doing for every other week for the past month or so. And we're going to have a good time tonight. So try to come out if you can't tell somebody to come to the Jack office, 2147 Lowry Avenue North for karaoke tonight. And we're going to have a good time.
And I also want to say that Step Up, I noticed is accepting applications through April the 14th. That's one of my favorite programs. So, if you have youth that need to get a job, get them in there. And April has an event coming up on the 24th. The violence prevention is happening on the 24th. So if you guys want to send me information, I'll put it out there for you. Other than that, we are close to the time. Mr. Clarence, did you have anything that you wanted to add before we wrap up?
All I want to say is thank you all for showing up at 7:30 in the morning.
Miss Ann?
I appreciate it. All right.
Do you have anything, Miss Ann?
No, thank you, everybody. It's good to see you all. Thank you for
Thank
being
you again, and you guys have a great weekend, and we will see you next month. I appreciate you. Bye.
Thank
Bye-bye.
you. Bye-bye.